Good evening. I'd like to call this meeting of the Caldwell County Department of Social Services to order. It's 5 o'clock. We're here at the Alden E Starnes building in the city county chambers. First thing on the agenda is going to be to pledge of allegiance and invocation. Will, you want to lead us, Will?
Yes. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And if you would remain standing, we're just going to have a moment of silence for those who have passed from COVID. God, we thank you for this day. We thank you for this time that we can come together and do the business of serving this community. We pray for our community, we pray for our nation, and we pray for this earth and the struggles with this pandemic. And we pray for those who have lost loved ones, who have lost friends. We know there are many people that are hurting, and we just ask for your peace on them. And we pray for those who are here tonight, for our board and for our staff and the work that is done through this agency, that we would be able to reach out to those in need and assist those families and those individuals who are struggling in many different ways. And we just pray for your guidance and watch care over us and watch care over this county. In your name I pray. Amen.
Amen. Thank you, Will. Next on the agenda is going to need a motion to approve the if there are any amendments of the Board of Directors. You got any amendments, Will, to the agenda? I need number 4 is going to be approval of the minutes, so I need a motion to approve the minutes.
I'll make a motion to approve.
I have a motion. Need a second?
A second.
Have a motion and a second. All in favor, please say aye.
Aye.
All opposed. Motion carries. Next on the agenda is going to be reports. Ms. Kim Arnett is going to give us an update on COVID-19 spending.
Good afternoon. Evening, I guess.
Evening.
Yeah. So I want to talk just a little bit about where we are with our spending in regards to the CARES Act funding we received last year. We received around $90,000 as part of that act, along with some very narrow guidelines on how we could spend that money. It was divided into different areas or allocated for different areas. One area was Child Protective Services and Adult Protective Services. Another area was for our foster children. And so some of the things that we were able to purchase for the foster children really had to relate to expenses for facilitating distance learning. And so anything that could assist with distance or remote learning. And so what we ended up doing was purchasing some laptops for a lot of the children that we had in custody, those that did not already have laptops. We also purchased some printers for those children and even paid for some tutoring for a couple of the kids who were having some struggles with remote learning. So that was because of the guidelines that we were given with this money. It was difficult to spend it in other areas for the foster children, but we were able to do that. I think, after we finished, because it has been extended now, it was to be spent by December the 30th. Now it is to be spent by May 30th. So we're going to be able to spend a little bit more of the allocation. And I think we're probably going to end up having about 50 laptops that we were able to buy for the children. So that's going to be very helpful for them as they, now, and of course as they move forward in their schooling. So in regards to the allocation for CPS, which is Child Protective Services, and APS, which is Adult Protective Services, the money was really very strictly limited to our assessments, which is our investigations of child abuse and neglect or investigations of adult maltreatment, and for our in-home or our case management, families that we're working with through that discipline, And it had to be related to telework capabilities, anything that could improve telework capabilities and couldn't necessarily supplement income or pay for any kind of hazard pay for our staff. It had to be spent for those particular capabilities. And so we were able to purchase some laptops that we didn't have previously for our intake staff if they were to have to telework. We were able to purchase some mobile printers, which will be very helpful for our staff even now, but also as we move forward to be able to print in the field. And so that's something they're very excited about. We were able to purchase various technology for virtual meetings or video conferencing, so that we were able to purchase quite a few items that's going to really help out both areas in adult services and child services. We were able to purchase some monitors, extra monitors and keyboards for our staff to use at home while teleworking, and also to help with our documentation assistance that we have been able to get for our staff. We also were able to help an adult who we were working with through adult services who was COVID positive. We were able to pay EMS to transport that individual to a placement that was willing to take him even though he was COVID positive. And so that was a really good use of that fund. So do you have any questions about any of this spending or any?
How much trouble have you guys had getting the laptops? I know there was a time when you could order them and it'd take forever to get them. Are you actually getting them?
We got the first shipment. We got 23, but it did take about 5 weeks, I'd say, maybe 6.
And honestly, that was quicker than what I was.
We were expecting.
Like you said, it was going to take a couple of months. So.
Well, it wasn't. They weren't supposed to be here till the beginning of the year, but they actually came a little earlier than expected. So with the second order that we will be placing, I assume it'll be the same. It'll probably be 60 days.
Yeah, I don't know. I don't know, as far as the monitor goes, we ordered a monitor yesterday and it was on the front porch this morning, so.
Yeah, the monitors aren't hard to come by, but the laptops are a
They're
valuable
hard.
commodity right now, so.
Fantastic.
Yeah, we really wish that we had a little bit more flexibility in how to spend those funds, but we did not, and we've been very careful to stay right along with the guidelines and to be very stringent.
Please do, because we don't want to have to get audited and have to pay
Well,
it back, so. that's
right,
the
and
whole-
so we've recently heard that there's, auditing started across the state for that fund, and so we've been very careful about
Yeah.
spending it correctly.
Will, has there been any discussion from the association about, working with the legislators to give a little bit more flexibility there?
I know they were looking at if more funding comes in, that we may receive more. I think our biggest issue was around what the state is saying the federal guidelines are around how we can spend it, because that was our main issue. Was it wasn't the amount of money, it was the fact that it was so narrowly defined.
You really couldn't spend it.
We
Yeah.
were just racking our brains to.
Yeah.
We honestly were able to
make
do
use
more
of
than we thought we would be able to do. After we started really brainstorming what would be helpful and how we could use it, we were able to use it more widely than we thought, but not as widely as we would have liked.
Yeah, I mean, we will still, now, we do have until May. They did extend
Right.
it. I'll be surprised if we're able to spend all of it, but we'll have more time to.
Well, I think, obviously the laptops are remote, anything type of remote learning or remote work from home type thing, that's a great, resource to have, so.
Yeah.
Just keep looking outside the box.
Yeah, we've had a lot of brainstorming sessions.
Yeah,
So-
I'm sure. Anybody got any questions for Kim?
All right, thank you.
All right. Next on the agenda is going to be Ms. Courtney White with, she's a supervisor and is going to talk to us about the emergency assistance report.
Good afternoon.
Good afternoon.
Hope all of you are well. I wanted to spend just a few minutes to give some background of emergency assistance and a couple of the funding sources that we utilize, mainly our two main funding sources that we utilize. Our crisis intervention program, we refer to it as SIP. is the funding source that is used to aid households that are facing a health-related emergency due to their heating or cooling need. Many of these households present themselves at the agency with a disconnection notice or have a need for some type of fuel that they're using to heat their home. Our other main emergency assistance fund that we use is called our Low Income Energy Assistance Program, also known as LEAP. And this fund aids a family only one time a fiscal year with a payment to their heating source. It has to be their main heating source. Many people utilize a couple of different heating sources, but this fund is only for their main heating source. This program begins in December, and it begins with households that have a member in their home age 60 and over, or someone in the home that's receiving services through the Division of Aging and Adult Services. Anyone that's not eligible in December, so that's anyone else who doesn't have someone in their home over age 60 or is not receiving services through the Division of Aging and Adult Services, everyone else can apply for this program in January. This year, the payments were either $300 for wood, $400 for LP gas or natural gas, kerosene, and fuel oil, or $500 for electric. And these particular households don't have to be facing any kind of crisis to be eligible for this program. It's strictly an income-based program. So those are our two main funding sources that we use, that we see most of our clients that are coming in to apply for emergency assistance are normally seeking one of these two programs in our winter months. So some challenges that we faced this energy season, obviously, were our COVID restrictions. We had to think about how we were going to operate this program with our staff that were teleworking. And we had to think about how we were going to incorporate the changes in policy. So those were a lot of things that we were faced with going into the energy season. The energy season at DSS is an extremely busy time of year. It draws a lot of our county's population into seeking services, not only for emergency assistance, but they apply for other services as well during that time. A lot of people during winter months are laid off because they have seasonal type employment, so it really draws a lot of people. So every year, energy season poses a lot of different challenges. But like all other things, COVID brought additional challenges this year. Around October of every year, we begin to meet as a management team to talk about our plans for the next coming year. We talk about what worked last year, what we think will work this year. We knew this heating season, we would have to think outside of the box to come up with different methods for interviewing our clients, obtaining the verifications from these clients, and how we were going to staff this program with over half of our economic services staff teleworking. We normally utilize additional staff in other programs to staff this particular program and the heating months. So some of the challenges that were posed this year involved how our clients could easily access these programs while maintaining the restrictions with COVID. Thankfully, the state received an additional $25 million for the Low Income Energy Assistance Program funding as a result of the CARES Act. A portion of this funding was used to issue automatic payments to a targeted population. These populations included households with persons aged 60 and over, or households receiving disabled individuals receiving services through the Division of Aging and Adult Services. These households also had to be receiving food nutrition services, in addition to have received this same funding last year. So it was a lot of criteria that an individual had to meet to be able to receive this specialized funding that was given to us through the CARES Act. Thankfully, Caldwell County was able to identify over 400 households that met that criteria. Because they met that criteria, they did not have to come into the agency or seek these services in some other way. They were automatically approved for this program in early December. Thankfully, the state also began to make allowances to alleviate counties to accept telephonic signatures, which allowed clients to be able to call into the agency, complete applications for energy assistance, whether it was for our crisis program or for our low-income energy assistance program. They spoke with the caseworker, and the caseworker completed the application with them over the phone, and we were able to process it. This all prevented the clients from having to leave their homes and come into the agency. One additional step they took was to finalize the energy applications online. The state has a website where you can access other economic services programs such as Medicaid and food stamps. Starting January the 4th, our energy programs, both of those funding sources went live onto our ePass website, which was really beneficial. Again, another way to help to not bring our clients into our agency. One thing that we're doing right now is because we have some, normally at this time during our heating season, we begin to look at our funding and what we have remaining. Last week, we looked at what we had remaining in our low-income energy assistance program, and we've decided to try and reach out to some households that maybe have not accessed this funding yet. And so now when we're making contact with anyone who applies for any other program, where we're speaking to them on the phone, we're going to be researching to see if they have accessed that funding, and if they haven't, we're having a discussion with them about whether or not they want to, at that time, make application, or whether or not we can inform them of other methods of ways that they can make application. And we started that yesterday, and we've already had a couple of people take advantage of that. So that's good. So we hope that we can reach some more people by doing that, because you think everybody knows about it, but truthfully, not everybody knows about all the services that we have to provide. So it's nice that we can do that. So just finally wanted to give you some quick numbers, because I'm a number person. I'm not as much a number person as Chris, but still like numbers. One thing that we were really taken back with this year was the amount of phone applications we would take. We had no idea how many we would take. We were quite overwhelmed, quite honestly. We had to enlist several additional staff in the agency and pull them away from what they normally do just to take these applications. So a number just to let you compare, because we really thought more people would apply online, but they didn't. They actually chose to apply calling in. So I pulled these numbers last Thursday. So as of Thursday, we had 83 online applications for energy, and we had 288 phone applications. So that's a massive difference. Regardless, I'm glad that people are accessing the programs, and that the state has made those allowances for them to be able to access it. I only think that this is going to change how we do business in the future, which I think is good, because there needs to be different ways for people to access these programs. So that's all I had. Do you have any questions?
Yeah, I've got a couple of. First of all, I agree with you. I think it's going to change the way we do business, and we have to be kind of open-minded in looking at different avenues, and the way we take, the way we market to the public via, social media, or, whether it's newspaper or whether it's billboards or whatever it is that,
Right.
how we get the word out to people, because there really is a lot of people who, who don't have access to different technology and things of that nature, and I think that is maybe why you're seeing some of that increase. But,
Right.
People, normally they would come see you, but they don't have access to the internet, so then they're going to call you.
Mm-hmm.
And this morning I had to call Anthem, had to get on Anthem Blue Cross Blue Shield's website. Oh my gosh, what a nightmare. Okay, and I just finally just said to heck with him. I picked up the phone and called, and I had to wait for a little bit, but I finally got the lady on the phone and got what I needed. But I could see how somebody, I'm not an expert at technology, but I could see somebody that's an elderly person who struggles
Right.
with technology
Right.
being able to access that.
Yeah, they don't
So-
have comfort to do the technology, and if they can't sit in front of somebody, talking to somebody is the next best thing,
That's
for sure.
exactly right. And it's a confidence thing there and access to it. Another way, and I know we've talked about this in the past, and I want to just mention it to you. In conjunction with EMS's community paramedics, that's a great resource if, when they're out visiting, making these client calls, because some of those guys or folks are your clients. And, being able to give them maybe a brochure or a handout or
Right.
something that says, hey, if you need
Yeah.
this service, then here this is.
Yeah.
and
Well,
that
we
type of thing.
we
So,
definitely have some flyers, and we can look at getting them some of those.
yeah, that'd be fantastic, with a website or a phone number or whatever on it.
Yeah.
The last question I have, was there any issues with the state funding that came through the CARES Act money where they actually automatically qualified? Was there any problem with them getting their checks that we know of?
Yes.
That's the reason I'm asking, because I kind of
Yeah, and
assumed
I
there was just
don't,
because
well,
it's
and
a
I
state
don't know that
program.
it's a state issue and when I try to explain it to the workers, you have to think about all 100 counties. All 100 counties had the same access to the same funding.
Mm-hmm.
And there's more people seeking this assistance, so in addition to the people that were automatically approved, you add on to the top of that, everyone who's applying every other way. So all the payments that are going to our vendors, all 100 counties are sending those same payments to a lot of the same vendors. So there's a lot of payments sitting at the vendor that are waiting to be processed. I'm not sure if Will has anything additionally to add, but I know that we have had some difficulty. We've had some clients that have been contacted by the vendor saying that they haven't received their payments, and we've worked diligently to try and follow up with that to make sure that they're not going to lose their services or they're not going to run out of their fuel.
Yeah, and we talked about this earlier, and Donnie and I had actually talked a little while ago, because we do have $109,000 that is waiting to be posted by a vendor, and so we've been in communication with
Is
that
it the one you
vendor.
asked me about earlier?
Yes, so
Did you talk to that person?
Yes, and they're working on that to make sure that gets posted. And I think, like Courtney has said, yeah, there's a lot of money flowing to different vendors, and sure, I'm sure they may have some issues getting those funds dispersed, but we felt like $109,000 was a lot to
That's
be
a little-
sitting around.
Yeah,
So
that's a whole lot of power bills.
it is.
Are those electronic payments, are they paid to the vendor electronically, or is that a check?
That's a check from the county.
Okay.
So,
Yeah.
these vendors, won't mention any names, were they aware these payments were coming?
Oh, they get them, we send them.
Did they know the state was gonna be sending this mass
Oh, yeah.
dump of
Yes.
payments? So they were
Yeah.
aware of that?
Oh, yeah.
I will say on the vendor's defense, in our office, mail is being held up
That's true.
Yes.
Yes.
bad, so it could be just a mail thing and not really.
The one thing that we did learn a couple of years ago in talking with this particular vendor, and it helped us to understand their process, was when they receive our payments, it comes in with like a ledger of everyone that's included on that check. It has their name, and it has their account number and the amount that they were approved for. If for some reason one thing is off on that list, if the name on the account doesn't match the name on the ledger, or if the account number is one digit off, just one of them, they send this ledger through an automatic reader and it automatically posts it. So if there's just one thing off, it throws that one out. And it goes to someone's desk, and they have to manually key them all in. Well, we knew going right into this that it wasn't going to go all the way through, because we already knew of some issues with some of the payments. So, and that does delay anything, that does delay it, unfortunately, so it takes time. I know it does. That's a lot of payments for a lot of counties to do that.
But we've not had a problem with somebody losing service because of it that we know of.
Well, we've tried to make sure that every client that's contacted us, that we have either called that vendor to make sure of it, repledged it if we had to,
Right.
did a new application if we had to, if they were already up for disconnection again, because a lot of times they were, because we've gone a whole nother billing cycle since then. So some of them were already up for disconnection. So the ones that have contacted us, as far as I know, there's not been any that's been disconnection or had any interruption in their services.
Well, we only have a couple of providers, obviously. from a power bill standpoint, so you kind of figure out who they are. But obviously, we have one local, so if you run into problems, I mean, I'm sure leadership there would not mind you picking the phone up and calling them directly. And obviously, the one you called today, I know the individual very well, and she'll generally get something done. She'll light a fire under them a little bit. So, anybody got any questions? I got one last question. Where'd you get that little fancy mask you got on right there? I have to keep mine in my pocket.
Well, I got this lanyard thing
Oh,
from
okay.
Amazon.
All right.
Yes,
All
the
right.
Zon.
It's pretty cool.
That is, yeah. At least you always got it with you.
That's right, yeah.
I'm always running, when I get in the grocery store, I got to run back to the car. I got to, so.
Thank you for your
Courtney.
time.
Appreciate your help.
Thanks.
Thank you all, do. Let's see here. Next on the agenda is going to be the mid-year budget report. Mr. Chris Conley.
Good afternoon. There's
Hello,
nothing
Chris.
fancy that I have on, Donnie, so
Yeah.
you won't need to make that comment.
Yeah, when you show us something fancy on, we're going to be worried about you, buddy.
Of course, our mid-year budget review, it's that time of the year again. It begins with Administration Department 5310. Simply due to normal turnover, our employee-related expenses are expected to underspend almost $270,000. Operational expenses, which is, everything from supplies, postage, vehicle fuel, mileage reimbursement, and a number of other expense lines, projected to underspend about $170,000. And before I go any further, I mean, really overall, our budget's in really good shape. Some of that's simply related to COVID. We're just not traveling as much. And certainly that's not the only reason. Moving into Department 5390, Child Resources, the first two lines are our state foster home and 4E foster care room and board payments. Obviously, our foster care numbers are down from what we're budgeted for. Therefore, those two numbers added together show a surplus of about $850,000 in available room and board payments. We're budgeted for 75% reimbursement in foster care room and board payments, so only 25% of that would be actual county dollar, but that is about $212,000. The adoption assistance vendor payments, which are related to completed adoptions, we're going to underspend about $6,000 in that area. The adoption assistance cash payments, which is payments to an eligible family of an adopted child, that is actually a 100% county expense line, so underspending that by about $124,000, that's a direct savings of county dollar of that same amount. Moving into Adult Resources Department 5391, we've talked many times in the past about our rest home and special assistance or SA expense being under budget. That also is a 100% county dollar expense line, so $166,000 is all county dollar savings in that area. And I think Will spoke a recent meeting about we've been having to pay more adult room and board payments this year than expected, and so that's an area in adult resources where we are overspending, and the only area of our budget that I've noted a projection of overspending But any overspending in that expense line can be covered by savings in the rest home line. So it doesn't present any type of issue to us other than just being unexpected. Department 5392 are all the temporary resource programs, some of which Courtney just spoke about, the energy assistance programs, along with Work First emergency assistance programs, all of which are reimbursed 100% to the county. And we only spend up to the amount we were allocated by the state. So no numbers there because we're going to spend as much as we can due to a number of eligible clients needing assistance, and we're not going to go above that allocation. Just as a note, SIP, LEAP, and the additional LEAP pandemic funds we received this year, those three alone total almost $1 million. So that's $1 million in direct service benefits to citizens in the county. Of course, a lot of the vendors are not necessarily located in the county. Some are, but some are not. So the money doesn't necessarily stay within the county, but the direct benefit to the citizens does. Department 5393, Medicaid, really the main expense line in that area of our budget is to cover any agency errors related to a finding, an audit finding in a Medicaid case. $25,000 is what is allocated. If there was ever a major error, $25,000 would probably only be a drop in the bucket to paying that back. Thankfully, we've never seen a situation like that, and hopefully we will not.
Would you have $47 charge back or something?
I think it was
Yeah.
$27?
20-something dollars, I think was our, that was
Yeah.
our
Yeah,
total, so that's good.
yeah, that's real good.
And a lot of staff time, related to working those situations, the monitorings, and then you put all that time into it, and you're paying back $27.
Nice.
Not really worth the effort involved, but it is what it is. The budget summary at the bottom of the page, we're budgeted for about $14,800,000 in expenses, with budgeted revenues of about $9.8 million. So our county dollar allocated for the year is just over $5,034,000. Expenses are estimated to come in at about $13.1 million, with revenues projected of about 9.1. So this time we're estimating our county dollar to be just under $4 million for the year, which is a little over $1 million more than what we were allocated. The notes at the bottom just provide a little summary of where that $1 million in savings is coming from. And I'll remind you again of the $392,000 that we received in August for prior year revenues. That's a big chunk of it. Without that, then we're looking at only about $650,000 of savings in county dollar. Also, our administrative expenses, we're saving a total of about $322,000 in county dollar in that area, about $560,000 in child resources, and as I mentioned earlier, $166,000 in the rest home expenses. So that's a brief summary of where we're at mid-year. I'll be happy to try to answer any questions you may have.
The $561,000 in the child services, just for the public's knowledge, that doesn't necessarily mean that we have children that we're not spending the money on.
Oh, no,
'Cause I know there's
absolutely
somebody
not.
watching right now thinking, my gosh, they got 561,000, and how about all these kids out here that need stuff? So
No.
elaborate on that just a little bit for the
No,
public's knowledge.
that's, again, the county dollar savings in foster care room and board payments, which I mentioned, is
Right.
about 212,000 just in what we're budgeted for. But in addition to that, I mentioned our revenues are budgeted at 75% of room and board payments. Revenues are actually coming in at about 81 or 82%, or the room and board payments are being reimbursed at about 81 or 82%. So part of that 561 is that we're receiving more revenues than what were anticipated. If revenues were only 75%, then we would only be looking at a county dollar savings of about 170,000 for the room and board payments alone.
And that can only be spent on those
specific.
particular
Yes.
expenses. So
Yes.
unfortunately, we can't just take that and then do whatever.
Do whatever you want to with it.
Yeah, do
Right.
whatever we want with it,
Right.
yeah.
Right.
Well, I can say that on behalf of the board and also the county commissioners and the citizens, we appreciate your, good management of this budget, making sure that your own budget, and it's always nice to see you come under budget. That's
Yeah.
what you want to do, so.
Uh,
And
I
at the
w-
same time, continue to provide the quality service that you're providing.
Certainly, and I will mention the estimate is just based on the assumption that in July, we received that final month of revenues for the current fiscal year that we did not receive last July. So that county dollar savings would certainly decrease if the state doesn't stay on schedule with reimbursing counties.
Right. Sounds good. Any questions? Well, Chris, as always, appreciate what you do.
Yes, sir.
And you do a great job, and thank you for all your efforts that you put in there and keeping all these other folks on track and watching the spending over there.
Absolutely.
All right. Anybody else? All right. Thank you, Chris. Appreciate you, buddy. Oh, you're up again, aren't you?
Yeah.
The monthly updates.
Yeah, I was just going to
You
roll
should have
right
just
into
stayed right
that.
into it, yeah. Back on for the monthly update,
Yeah.
Chris.
We'll keep it brief. Our reimbursements for the month of December totaled $583,207. Receivables at the end of the month were about $1,232,000. To the far right of those numbers, our expenses for the month totaled $1,329,794. So our county dollar expense for the month was $746,587, which is high compared to a normal month. However, it's consistent with what we anticipate for December, with December being the first month that the energy programs really open up. So expenses in those programs alone totaled almost $320,000 for the month, which again are fully reimbursed. So before the end of January, we should see the reimbursement on those December expenses come in. Looking at the current year compared to last year, our expenses are just slightly a little over 19,000 more than they were at the same time last year. Revenues are actually exceeding prior year by $403,000. Again, that's the additional revenue received in August. So our county dollar year-to-date is $384,637 less than it was the same time last year. Do you have any questions regarding the monthly report?
Anybody? No questions for me?
All right, thank you very much.
Thank you, Chris.
Thank you.
Next up is going to be Mr. Will Wakefield with the director's report.
Just a couple of things I wanted to mention. We obviously talked about COVID a lot and the impact, certainly that's had on all of us and certainly on our agency. I wanted to talk just a little bit about some of our adult services areas. COVID has seemed to impact our adult population a lot. We've had a number of wards who, they've contracted COVID. We have had some who have passed away due to COVID. We've also had, had some families that we've worked with through our adult protective services areas who have been impacted by COVID a lot, and which has caused us to have to kind of jump into action and work with those families, probably in ways that maybe we would not have worked with them in years past. So we have certainly worked a lot more with those families, with those individuals. We've had to do a lot more work with some of the facilities that we work with and trying to find placements. And if you've done any of that with family members or friends or what have you, getting people in and out of placements right now is fairly difficult because, they're concerned about COVID. They're concerned about whether or not that individual has COVID, what's happening within that facility itself. So there's a lot of things to think about. And with many of the situations that we deal with, typically timing, usually it's an emergency. Something's happened, there's an emergency, we're trying to get someone placed. So that has certainly caused our staff to have to really, do some things differently, really work with contacts in the community and contacts with those facilities to be able to get adults in and out of those facilities. I wanted to say a big thank you and mention to you Happy Valley and Tom McCrary over at Happy Valley, because they have allowed us to bring individuals, have them tested, have rapid tests, and be able to move quickly to get those individuals placed, which is a big deal because if a facility has a placement ready for you, they need you to go ahead and take that placement as quick as you can. Otherwise, you may lose that placement. So that's been a big help for us. As I mentioned, we have had some wards who have passed away because of COVID, and there are certainly times where we have to make end-of-life decisions for some of our wards, and that's never an easy thing to do. It does happen, and we have had to do that recently. And I just wanted to mention that when we do that, when we are called upon to make those decisions, because the agency is we are the legal entity that has to make those decisions for that individual, we certainly take that seriously. We gather the individuals around the table who have worked with that family, who have worked with that individual, the social worker, the supervisor. We talk to the medical personnel that are working with that individual. Obviously, I'm involved in that decision and making that final decision. Kim gets pulled in to some of those decisions. And we talk with the family if there's family. We talk with those medical folks. We talk with our staff. And we really just try to make the best decision that we can make based on their situation. And that's not always easy to do. But we do feel like that we want to treat those wards just like we would treat our own family member. And so we have been called upon to do that as well. And so as you think about folks out in the community and obviously many people who are impacted by the pandemic, excuse me, I think it is important to think about a lot of those adults out there who've been impacted in a lot of ways, a lot of isolation, not being able to get out about and do the things that they would normally do, and so we have seen that, and that has greatly impacted the work that our staff have had to do. And but I appreciate our staff, and they've really worked hard in taking care of those situations. Our health department, our emergency services, we work closely with them in a lot of those situations, and that's always been a good relationship, and we appreciate those folks in working with us, and when we come calling asking for favors and guidance and help and all of those types of things. I also wanted to mention that as our health department, as our emergency services, deal with a lot of the stress that they are under with COVID and a lot of the things that they have to do and the activities that they have to do. We have asked our staff if they are able to assist in different ways, and we have had staff who have been able to assist over at the EOC. We have staff who have volunteered to help the health department as they, hopefully, sooner rather than later, are able to get up and running more with vaccination processes and things like that, because we know that their staffing, they're going to be under a lot of pressure. And so we have worked to make sure that if we have some staff who are available to pitch in, that we want them to be able to do that. And so we do have a number of staff who have stepped up and have been willing to volunteer their time, because we think that, we think that certainly is important, and it's kind of an all hands on deck kind of thing. And so that is important, very important to us. So those are some of the things that are going on. There's obviously with our energy season time, that's just one of those things, as Courtney was saying, that it's always a busy time of year, and it seems like every year it's different, and this year certainly it's very different, and we appreciate those staff and just kind of looking at things differently and figuring out new ways and efficient ways to handle that. I wanted to welcome back Martha. Martha's been away on some leave for a time, and we are glad that she is back. She has just come back, but I did want to say a big thank you to Courtney. Courtney is one of our lead supervisors in our economic services areas, and so she takes over when Martha is unavailable, and she has done an excellent job, and so we appreciate Courtney doing that over the past couple of months. So thank you for your work. But again, everyone is glad certainly to have Martha back in, and we didn't give her any role tonight because she just started back, and so we were going to give her a few days to catch up on everything else. So.
Well, I'm glad you recognized her, because I was getting ready to, before we got through, I was going to welcome her to the meeting there. She had a mask on a while ago, and I was like, well, I think that's Martha, but I ain't 100% sure. I didn't want to call her Martha and it'd be Anna, somebody sitting right there, You creeping on me, yeah. You were talking about, going back to Courtney's comment earlier about the phone calls, is there a possibility that you could use some of that money to hire temporary staff to field those calls? Is that? Because it kind of relates back to the distancing, can't get there.
I wish we could. Those funds are specifically for protective services,
okay.
And if it doesn't tie into that, then we're not.
So there's no money there. I got you.
Right.
All right.
We have in our budget. Because of energy season, we do have about 3 people that come in during this period of time. But because of COVID, because those people have to be trained, and so it's individuals who already know what they're doing.
Right.
We were able to only get one of those individuals to come in. But, I will say again, the staff have really figured that out, and done what they've needed to do to kind of change things up and get it taken care of.
They always do.
So they do. They do.
Thank you, Will. Any questions for Will? All right, next on the agenda is going to be Ms. Kim Arnett again with Child Services Highlights.
I want to just touch briefly on vaccinations. And so as the state has talked with us just recently about vaccinations for children in the state's custody, that's going to be some time from now, because we are just currently in the phase of 65 and older, and then we'll go to the phase of essential workers. And so it will be some time before that comes up. And so I just want to say that we've started talking about that a little, and talking to the supervisors, especially who supervise workers who work with children in our custody, about when we get to that point, we will have to look at parental consent for these vaccinations for certain children whose parents still have, their parental rights, or we will be looking at a court order to get that vaccination if the parent's not willing. So we'll have to be doing that as we move forward. And so right now, it's just, we're just talking about it and looking at a plan for how to start implementing that once it starts happening. So that's all we know about that at this point. I will also mention that we have, at this new year and part of last year, we've really been trying to focus on training our staff. We were very lucky for quite some time to have very small amount of turnover. And this is typical in protective services and in permanency services. You have waves of turnover. You'll be stable for a couple years, and then you'll have a wave of turnover. And it's not usually significant, at least for our agency. It's not been significant, but it is usually isolated to one area in Child Protective Services, and that is investigations and assessments. That is where the social worker receives a report of maltreatment and goes and knocks on someone's door, and that's their first contact with our agency. You know, that is the first person that they see from the agency, and they investigate those allegations of maltreatment. And so it's a very crisis-driven, crisis-oriented position, and it is, you know, it's a lot of burnout in that position. And so we get a lot of more turnover in that discipline than our others. And so we're really trying to work on some in-house trainings for especially those staff, but all of our staff in general, and looking at things like general social work skills, how we train for that, how we train to interview, how we train to do case planning and working with families, how we train to document what we do, because that's a huge part of what we do. You know, the state does offer trainings. They're limited, and there's limited space for those trainings. And with COVID, I will say that the accessibility to those trainings it's become greater because they're virtual, but they're also virtual. And so that in of itself makes some of these a little less effective. If you've ever taken a training on interviewing, it's really hard to do that in a virtual environment. So that's why we're trying to start our own training process, and we're working hard to do that. And we'll be talking more about that as we move forward. But I just wanted to tell you guys kind of that's one of our big projects for this year. So I'll talk a little bit about our data that is on your highlight sheet. I just wanted to talk more about what our end of the year data looks like year to date in December of 2020. So our assessments or our investigations that our reports that we investigated in 2020 was 785. So that's the total amount we investigated. Now, we got a lot more calls than that, but those are the ones that met the definition of abuse, neglect, or dependency that we were able to go out and investigate. So probably about 30% were what we call screened out, which means they didn't meet that definition. So if you can do that math in your head, I'm not going to try to do that in my head.
Chris.
Yeah, Chris maybe can do that in his head.
65 a month, about 95 total calls.
There you go.
Maybe so.
Keep that
I'll check that
calculator
later
handy.
for you.
Keep that calculator handy.
Yeah. So anyway, that's a lot of reports to investigate. And what we've seen with COVID, and you know, obviously most of the year we dealt with COVID, it's harder to investigate while we're dealing with a pandemic and our staff being scared to, you know, go into the homes because of, you know, risk of exposing families, but also themselves. And so it's been a struggle. Our foster care numbers for 2020, we had 76 new children enter custody in 2020, but we had 88 exited care in 2020. And those are, when children exit care, they can exit care through various ways. And one way is reunification with parents. They can be placed in the guardianship or custody of a relative, another caretaker. They could become emancipated because they turned 18 while in custody. So there's different ways, or they could be adopted. And so we had more children exit care than enter care last year. So I think that's important to point out. Yep. Our adoption numbers for 2020 did end up totaling 51. I know about a month or so ago, I think we were at 51, but we were not able to get any more finalized in December. So that was 51 for the total yearly adoptions. And I will say, too, our foster care 18 to 21 program, in December we had 15 youth in that program. We have a monthly, what we call a county consultation with our state consultant, and she was very impressed with our the number of youth we have involved in our 18 to 21 program. She said that's actually a very high number, and not a lot of counties have that many youth. And I think that's really a statement about our permanency workers and the relationship that they have with these older youth, and encouraging them to take advantage of this program, because they know that, you know, when a child, well, I say a child, but when a youth turns 18, especially some of the youth that we have, because of what they've been through, they're just not ready to be out there and be independent. And so they really encourage them to take advantage of this program. So we have quite a few. You know, we have a good number. I think we might be up to 16 now, so.
That's great.
So, yeah, it's a good program.
Quick question. So the workers that have to go and investigate these calls,
Mhm.
Do you offer them any additional PPE other than just a mask?
We have face shields, we have goggles, we have gloves, we have masks, we have all the sanitizing, you know, hand sanitizer, Clorox wipes, Lysol. We have a whole room dedicated to our supplies, and, you know, we've talked very openly with our supervisors to make sure that, you know, staff know we have these things. If, you know, we have a closet on the floor where all the social workers' offices are, where we keep, you know, supplies there, but they know if we're out here, you know, we have more. Don't be afraid to ask. Don't go without something. So, yeah, we do. We have a lot. We have gowns, too. We actually did have to really don all the PPE in one instance, because we had to transport what we thought was a COVID-positive child from a placement out of county back to Lenoir. And so I will give a shout out to Happy Valley for that situation too, because they really helped us at 8 o'clock at night on a Friday to get that
Yeah, they do a
child
great
rapidly
job out there.
tested. So, yeah, that, yeah.
You know, I know, I hear law enforcement have seen a pretty significant increase in child sexual assaults because children are home more. A lot more reports of it.
Yeah.
I know that I was having a conversation with the sheriff recently, and they had a pretty good unexpected lift in those type of cases, and his thoughts were is they're just home more, you know. So I know that during this pandemic, that may be why you're seeing a lot more reporting of things.
Yeah,
possibly.
sure. We've seen an increase over the past few months when the schools opened up, because, you know, before that, we saw a significant decrease, which was concerning in and of itself. Sure, you know, you have less reports coming in, but also you have less reports coming in than normal, and that makes you question, okay, so things are happening that we aren't being told about, because just on average, this is not typical. And so, you know, that was a concern. But as we moved forward and kids started to be around other people, you know, in the school system, and then maybe going to the doctor more, we did see an increase back to somewhat normal, I would say.
Do you see, from the percent of reports, how many of it does come from the school teachers or school system, just out of curiosity?
Typically,
Just
oh gosh, I don't want to guess. Typically, it is a larger percentage. I think this year we will see a smaller percentage, just because they have
Have been
less.
less.
Yeah, they have less contact. Gosh, I don't want to guess.
That's okay. I just know that that's a great resource. you know,
Yeah,
'cause the kids-
I can look,
the
and I
teachers
can-
have that relationship with those students, and the students
Yeah.
are a lot of times more comfortable talking to those teachers.
And that's where we get a lot of valuable information
Right.
about families and about children.
Yeah.
And, you know, we really try to encourage our staff to form those relationships with teachers and counselors and social
Yeah.
workers. And Jill,
That's where I was headed,
you know,
is
when-
that relationship that y'all
Yeah,
have
and,
with the teachers.
you know, when Jill was in the school system, we talked a lot, and I miss her being there. But
Well,
just
thank you
because.
for that.
Not-
And I do know that the school system is a large source of your reports, just because they
Yeah.
spend 6.5, 7 hours a day
Sure.
with the students. And you know, while they were at home during the pandemic, they may not have had anyone to report to.
Right.
So that's a sad thing,
Yeah.
that, you know, some of our most vulnerable children were left unprotected or without a mentor or a go-to person during that time.
Yeah.
And I'm really glad, I mean, I know it's hard to weigh out whether it's better to be in person or remote, and our county is one of the few in the area that is still doing the face-to-face classes. And I'm glad that we are for those
Yeah.
kids that need it.
Absolutely.
Even though, there are some risks associated, I almost feel like that the other risks are greater.
Absolutely.
And so, I mean, kudos
It's worth the
to,
risk.
kudos to Caldwell County Schools for trying to make it work and supporting the kids and the families as much as they can.
Yeah. I do want to give a shout out to, don't really know who they were, but your social workers in a recent incident that happened in the middle of the night. And
The one we spoke about?
yes,
Yeah, so,
so I do want to,
yeah, that was our on-call, Allison Watson, and our supervisor, Wendy Powell, who dealt with that
yeah,
situation.
they did a great job, and it's all about communication and understanding one another. But it was when I finally got to the bottom of it, they did a fantastic job, and they were spoken very highly of by the people that were involved in it. So
Yeah.
please
We have
take our
some-
appreciation
yeah.
back to them.
I will. We have some great staff, and they work really hard, so.
And we just had a recent situation in the adult side too, regarding a situation where I think the social worker actually had to go out to the scene, and so I don't know how that all ended, but I know
Yeah.
that got back to me, and they did a fantastic job as well. So
Good.
y'all may know more about who that was, what I don't know.
Yeah, I don't remember
Yeah.
which situation that was.
Yeah, it was a pretty rowdy situation, let me just say that. An individual was not very compliant, and they were having trouble, and they needed assistance from a social worker from DSS to intervene, and the person came out, with a matter of just a few minutes, and really helped and
Good.
got to the root of it and resolved the problem, so it was greatly appreciated.
Good. Good to hear. Thank you.
Thank you.
Thank you, Kim.
All right, next on the agenda is going to be Mr. Will Wakefield, and he's going to give us an update on adult and family support services.
We've talked a good bit about different areas within these programs, so I won't hit on too many things, but I do want to mention childcare. We talk about every month. We are still on a waiting list. Our spending's down about 106%. If we do get to the point where we get around 100 or a little bit lower, we will begin to add some children to keep that at that 100%. The state has said that they do have the funds to, if we do end up overspending at this moment, they do have the funds to cover us, so that's a good thing. Medicaid transformation, it's probably been a year and a half ago. I started talking about this a little bit to the board, but then with the issues with the state budget before COVID, and then with COVID, Medicaid transformation kind of, went off the rails. Basically, that is managed care for people on Medicaid, and we will have a session on this in the next month or two to kind of bring you up to speed. But that is back on track for July, so we'll be talking more about that and how it affects us, but really more about how it affects those individuals in our community who aren't used to having to make some choices about their health care, kind of like you and I may have to do sometimes with plans and all those kinds of things, and so they're going to have to learn how to do that. So it's going to be a little confusing. So we will talk more about that as Medicaid transformation gets up and running again. I also wanted to mention on our food nutrition benefits, typically you'll see up there we have around 13,333 individuals on those benefits. In a year other than this year, the amount of dollars on a monthly basis would actually be a little bit less. But because of the pandemic, there are additional funds going into that program. So that $2.4 million is a higher amount of benefit that is going out to those individuals in our county. So at some point in time, that will decrease. And if you looked at the year before this, that number would be lower. But because of the pandemic, those individuals are receiving additional benefits within the food nutrition program.
Fantastic. Anybody got any questions? Well, I want to close out our meeting and make sure that you take back our appreciation to our employees there at DSS. I know that they're always appreciated, but I think this past year has been a challenge for everybody. And I really do think that when you look at the scheme of things and the way that everything hit, they adjusted well. I mean, you can't say enough about them, that they figured out how to get the job done. We didn't lose any game, we didn't lose any ground, we didn't lose any services, we didn't fail to meet with somebody, we didn't drop the ball. I mean, so kudos to you as a director of the department, but also kudos to all of our supervisors and leadership team, and as well as our employees for doing the things they did and accepting it and working through it and finding a solution, because it's been a disaster this past year. So hopefully we're getting on the other side of it. We just have to hope and pray that's where we're headed. I think we're, from a COVID standpoint, it's probably here. We just have to learn how to live with it. And but we've learned a lot from it, obviously, and I'm excited to get on the other side and see what we're able to do. And again, just please take back our appreciation to our staff. So, anybody got any questions? Anybody want to say anything else? Martha?
Just thank you to Caldwell County DSS. You guys always do a great job. Even before the pandemic and after the pandemic.
Absolutely.
And during the pandemic, you guys have done a great job. And you always keep the kids first, and I appreciate that.
Welcome back, Martha.
Thank you.
So we're excited to have you back, and look forward to getting you back in the seat there in the saddle and getting everything going there. So and thank you, Courtney, for stepping in and helping out when you had to. So our next board meeting is going to be on February 23rd here in the same location at the Alden E Starnes building. And with that, I will entertain a motion to adjourn.
I'll make a motion.
Got a motion? Need a second?
Second.
Got a motion and a second. All in favor, please say aye.
Aye.
Aye. Meeting is adjourned.